Hi everyone, myself Nitesh Lohan and I'm working as a research officer in ETCH consultancy. Today I'm going to present about menstrual hygiene situation in South Sudan. So yeah. So before I start, I would like to thank all the Christian Aid team members and my co-authors for this work. So South Sudan is a highly vulnerable country in the context of disaster management as their coping capacity is very low. South Sudan is prone to lots of hazards such as floods, COVID-19, conflicts and displacement, snake bites and food insecurities. All these hazards have different impacts on the lives of South Sudanese. If we talk about floods, the area is waterlogged and all the farming land they have, it is covered with water, and other than that their schools and transportation, small businesses were shut down. All these situations affect the lives of South Sudanese, and during all these situations their food is also short and the health sector is also very poor. So people are not even looking at menstrual hygiene management. That was totally neglected by the people of South Sudan. So for this research particularly, we took two counties of South Sudan, that is Ayod and Fengak, and mostly our respondents were female. Factors that affect menstrual hygiene management mainly, that are views on menstrual hygiene and what kind of resources the community have, what is the situation of wash there, and how they dispose the menstrual hygiene products. So views on menstrual hygiene. Menstrual hygiene is not think as a taboo in the society of South Sudan. If you look at the data, only 20.54% of the population or the community population answered that they view menstrual hygiene with respect in the community. Other than that, females have to suffer with domestic violence as they have to face gender bias situations. They are considered as the food maker or food collectors of the family because they have the responsibility to feed and cook for the family. And if they were not able to do so, they have to face lots of domestic violence for that. This is the review of one of the respondents, so you can read that. So let's move on. Resources. If you look at the data, only 17.6% of the population have the proper menstrual hygiene products that are available to them. And if we talk about one-time sanitary napkins, they are not even like considered, or they were considered as very expensive. So that's why females are not used to use them. In that they have to use like reusable sources that are available at their houses, such as rags and old clothes. That is highly, like, you can consider not that much hygienic because they didn't get proper resources or sunlight to when they dry them. So one of the female even said that we just let it flow and avoid going near men's. We do not have sanitary towels. Most of women here don't even know what that is. If we look at the wash situation in South Sudan, you can say that they didn't get proper sanitation there. As South Sudan face like flood situation almost every year, and when we collected the data, they are facing like COVID situation also. So you can see that the access to the latrine is only 6%, and they have like lots of resources for fresh water resources, we can say, but due to floods, all these resources were contaminated. So they have to use this contaminated water for everything, like for cooking and washing their clothes and washing themselves also. And in like a hand washing station, first they are not like that much available. If we look at the data, 94.3% of the population don't have access to hand washing stations. Other than that, they have to use like soap, if we say that, but the soap is also available to only 13.71% of the population. So they have to use normal water or like ash or mud to clean their hands. And all these things affect the health of the community, as they have to drink that contaminated water, and then they don't have proper resources to clean themselves. You can read this, and you can see that in the picture people are using that canal system, and you can see the boat situations they are using. And it's also highly like expensive to use these canals for transportation. So what kind of methods they use to dispose the menstrual hygiene products? If we look at the data, most of the women, almost like 40.8% women, they have to hide them. And other uses like burning methods, and like they throw it openly, or some of them use they use like reusable methods. So all these, like if they throw them or burn them, they both have like health issues, because burning is also very harmful to them. And other than that, like if they throw them in the open areas during the flood, it also contaminate the water, and they have to use the same water for all of their basic needs like cooking and all. So this is like highly unhygienic for them, and they are living in an unhygienic situation. So all these things put a pressure on the females also, and but the life of all the men's and children's and elderly is there, but especially female, because they have to fetch fishes in that flood water only. And that make them like they that expose them to lots of health issues and vaginal infections also. So at the end, we can say that the organizations such as us or other organizations, we can provide them alternatives, like some sustainable methods to you manage their menstrual cycle, such as we can say menstrual cups that will be handy for them, and they can reuse it again, and more like nature friendly. And we can reduce the waste of that area, like those who are using one-time use sanitary napkins, and other than that the reusable things, because they don't get proper sunlight, so it is at the end affecting their health. Yeah, that's from my side. Thank you so much. I would like to end my presentation here. Thank you.